Very good. All right. Hello, sir. All right. I would like to welcome everyone to the September 22nd meeting of the Health and Education Committee. Before we begin, I need to read electronic meeting notice. This meeting of the Health and Education Committee is being conducted electronically pursuant to Governor Bill Lee's Executive Order 16. I would ask for a motion that conducting the meeting electronically is necessary to protect the public health, safety, and welfare in light of coronavirus.
Madam Chairman, I move to approve.
Second.
Very good, thank you. Can you call the roll for us?
Commissioner Cook? Yes. Commissioner Blair?
Yes.
Commissioner Key? Yes. Commissioner Gammon? Commissioner Gammon, turn your speaker on, please. Your microphone.
Yes.
Thank you. Commissioner Gurley?
Yes.
Commissioner Phillips?
Yes.
Chairman Allen?
Yes, thank you. Before we begin into the agenda, let me welcome Rod Key to our committee. Welcome. We're happy to have you, and we're going to start you off nice and easy on an easy meeting. So. I say that, and then wait till school board pops something up. They'll surprise us at the end.
And we're here for 8 o'clock.
Yeah. Okay, our first order of business is to approve the meeting minutes.
Madam Chairman, I find that the minutes are in order, and without objection, I move for their approval.
Very good, thank you. Very good.
Commissioner Blair?
Yes.
Commissioner Key?
Yes.
Commissioner Gammon?
Yes.
Commissioner Gurley?
Yes.
Commissioner Phillips?
Yes.
Commissioner Cook? Yes. Chairman Allen?
Yes. All right, next we have the Health Department. Ms. Garrett? Welcome.
Good evening. Today I bring the August Health Department report to you guys. You'll find that on your iPads. As you know, we lifted our continuous operation for emergency plan in July. So we're starting to see some of the regular services that we offer, those numbers to come back up. You'll see that our WIC numbers are coming back up, immunization, family planning, men's health, women's health. And by October, we should be back to pre-COVID schedules and seeing of patients. We are still seeing patients a little differently through the infection control measures that we have to take. Some of it, WIC, which is a federal program, the Women, Infant, and Children program, they are still doing that all over the phone. So patients are not coming in for that service. That is one of our largest services that we offer. Somewhere around, we see about 150 to 250 patients a day pre-COVID, and about 70% of those were WIC patients. So we're doing all of that over the phone right now, continuing through federal government orders, at least through November that way. So as that changes, I'll update you. We got to do a little bit of prevention work, getting back out in the community. We did some student packages with MTSU, 5,000 for people moving into the dorm, giving them masks. It was a partnership with the health department, a couple of sororities, the president at MTSU, and we gave out 5,000 of those kits that had some hand sanitizer, just some welcome to campus, some guidelines and mask and some other things. So we packed all of that and gathered that and gave it to the students as they came back. We had some fun news that happened with our assistant county director. You guys, a lot of you have met her. She's come to some of our meetings. So she got a couple of great recognition awards that all kind of came in a row. She was the Athena Young Professional of the Year Award winner, the Tennessee Public Health Association Public Health Worker of the Year Award, and MTSU Young Alumni Award of the Year. So all those came like
That's
boom, boom,
fantastic.
boom.
Congratulations.
But it was a wonderful surprise, and we're very proud to have her on our team, and all of the great projects that you've heard us talk about that she's helped man. And I know I also sent that press release to you guys, so you would have that as well. No, I'm not sure. Okay, I'll find out which one is hers. I sure will. Yes, yeah, I'll find that out. Thank you for thinking of that, Commissioner Cook. To add to the list. Just a little update on COVID numbers and testing. So we are still testing about 200, 250 a day through the health department. Our county is testing somewhere around 800 to 1,000 a day. So there is a lot still of testing that is happening in our county. That was the most recent numbers. It was around 900 testing a day. We're still getting around 50 positives on average a day. So we're right around what we would expect at this point with our numbers. We're still able to get testing done for persons at the health department, no restrictions. It's drive-through, you don't get out of your car. Takes less than 10 minutes if you need to be tested. Doesn't matter if you're symptomatic or not. There's just no restrictions, so they can come through there. We are still able to get those results back in about 48 hours is our turnaround. And last month when I was here, I told you it was about 48 hours, so we've still been able to maintain that turnaround, which is very helpful in our case management and contact tracing and things we have to do to help control COVID. Of course, the schools, the city, the county, the private, MTSU, and the daycares are keeping us very busy right now as we're all back to school. So we've been working, we have a whole team, at least 10 employees working pretty much all the time on that with the schools, directly communicating with them and helping give guidance and figure out what we need to do and those kinds of things. So.
Dana, what is our current positivity rate?
Our current positivity rate as of Monday the 20th, for the last 7 days, the average was 8.4%.
That's good. You're moving in the right direction.
Finally have gotten into the yellow zone. So green is best, red is not so good, and yellow. So we're in the middle and under that magic 10% that, if you remember a few months ago, we were all, praying to get under. So we're finally getting there. So that's good.
Have you had to suspend your dental services altogether?
Yes.
Okay.
We are still seeing emergency dental. So a child in pain, an adult in pain, those kinds of things, we will see them and take care of their needs. But the preventative services, we should start to be able to see those pretty soon on a regular basis. It coincides with my dentist is going to be going on maternity leave soon, so just when we get back to seeing, then our dentist will be gone for a little while. So, but yes, we are still trying to take care of the emergencies, and the preventative stuff will start back full swing by October.
What's the plan for emergencies when she's out? How will you handle that?
Yes, so we have backup dentists in other counties that will agree to see them at our other clinics.
Okay.
So Williamson County, Wilson County, Sumner County.
So the patient travels to them?
Yes.
Okay.
Yeah.
Okay. And then do you want to give us any kind of update on flu vaccines? And
Yes, so we should be getting our flu vaccine protocols and guidelines soon. We're working with the state to set up what that's going to look like. When will they start being given out? Is there any cost? Can we do them through the drive-through? So those are all plans that we're working on pretty much daily with the state developing the plan. I was hoping to have a firm answer by tonight, but we have another call, excuse me, on Wednesday to go over some more details. But as soon as I know more, I'll let you guys know. But yes, it's coming soon.
Commissioner Blair?
What are you hearing from the CDC and some of your professional colleagues about the fall surge was as much on everybody's mind back in the spring as the actual virus at that time? So
Right.
are you,
So we have been worried that there could be a convergence of the COVID and flu, and we were worried about what that might look like. So one of the things you can do to help that is all the things we're doing to prevent COVID, which is keeping our distance from each other, and when you can't, wearing your mask, washing your hands. You know, still those kinds of things will also help prevent flu as well as COVID, and getting your flu vaccination. So that was going to be the recommendation, to try to prevent that. That is a worry, though, if we got a lot of flu cases and a lot of COVID at the same time. Hard to distinguish between the two. Treatments and those kinds of things, contact tracing, would be very difficult. So we hope that we'll have a low flu number by keeping up with our things we're doing to prevent COVID and by getting your flu vaccination.
so if someone goes to say a walk-in clinic thinking they have the flu and they do the flu test, you think, will they do the flu test and then decide whether or not to test them for COVID? How would that work?
Yes, and depending on the type of provider, they may be able to do a respiratory panel that would check multiple things at once, or they may just do the instant flu test and then do a rapid COVID test as well. So, but again, it causes more challenges that time of year. Just like now with allergies and a lot of people having seasonal allergies, that causes trouble for distinguishing as a medical provider between the two, and we have to do a lot of testing to kind of rule that out.
Well, I know that was a conversation actually you and I had last week, which was it can be both and. You can have the allergies and you can have an addition, a COVID. Yeah.
Yes, exactly. So just because you say, oh, I always have seasonal allergies, it doesn't mean that those symptoms aren't masking COVID symptoms or mimicking COVID symptoms as well.
Commissioner, use your microphone, please. Oh, thank you. Yeah, turn it on. There you go.
The number on the community events, the 5,040, what is that reference?
Yeah, so that's the people that we touched during that time, not physically, but that we reached out to. And that was mainly our big prevention project at MTSU, where we were bringing back the students.
That was the one you mentioned?
Yes,
Okay.
yeah. So we gave out over 5,000
Right, okay, I see that.
kits to them and education.
Any other questions for Dana? All right, if not, I'll entertain a motion.
Second that?
Commissioner Key,
Yes,
Commissioner Gammon,
Yes.
Commissioner Gurley,
Yes.
Commissioner Phillips,
Yes.
Commissioner Cook,
Yes.
Commissioner Blair,
Yes.
Chairman Allen.
Yes. And then Dana, before we let you go, is there anything that this committee or commission can do for you to support you any more? Anything you guys need?
I think we're doing good. We know we reach out to the EMA has helped us a lot. We've been reaching out to them, as well as the ambulance service has been sending people to help us with testing. So everybody has really done their part, and we greatly appreciate all the support. But I am in communication with you guys pretty often. Should I need something, I'll be sure to request.
Well, we just can't thank you enough. You're doing a fantastic job. We really appreciate you.
Thank you so much. Appreciate your support.
Thanks. All right. As Community Care, Mayor or Carol, if you have anything you want to share?
Commissioner Cook, have anything? Okay. All right. Thank you, members. Community Care had its board meeting last week. The board chose to go ahead and take some of the stimulus HHS money that was given to us to give a bump and a bonus. It's a one-time bonus of $250 per employee that is full-time and $125 for the people who are part-time. And that is, they were questioned, is that $250 net or $250 gross? You know, but sometimes when you give bonuses, you end up with nothing, and so the decision was to make it net. The employees have worked extremely hard. They're tired. They've been working more than what they normally do just to keep everything wiped down and clean and keep it as pristine as possible. So that was accepted and passed by the board. The governor came out and made a executive decision effective October 1st that based on each individual nursing home in the state of Tennessee, that if the nursing home had no new cases of COVID for 28 days, then they would be able to allow the essential caregiver program, which would allow family, caregiver, et cetera, to come in and help feed, bathe, dress, et cetera. Otherwise, it comes down to October 1 allowing that, but unfortunately, we haven't been so lucky. You know, we started out when the first patient with COVID was identified in Rutherford County back in March. I called and shut down the nursing home. And we had not had one case, not one, up until after the 4th of September. And what happened was after the 4th, Labor Day, TOA opened back up to our patients and said, now we're open. So if you want to come see, you got a hip, knee, anything else, most of our patients usually do have some issue orthopedically. They set an appointment, went to see the orthopedic doctor, and of course called and talked to the family members and said, we're getting out, I'm going to the doctor, or we're going to meet you over there, Granny. And what happened was we put them on a bus, take them over to St. Thomas, we get them there, they all come up, start taking pictures, hugging, kissing, etc. Go upstairs with them to the doctor's office, come back down, tell them bye. They come back, they're infected, they go back in and infect everybody else. Unfortunately, we have several staff members and residents that are now infected. We've got them quarantined into the wing that we were planning on renovating until COVID hit. So we've had to put them all in there and keep them in quarantine. So I talked to Russell Caron, our director out there, and I said, so with this October 1 date looming, when could we next allow family members or caregivers to come in? So our last resident to test positive was on 9/18, just last week. So that means that we can't allow anybody else to come in until October 16th at the earliest. That's if we don't get any more that test positive. So you get another one test positive, it extends it, 2 more weeks. So that's where we are. Other than that, we're doing everything we possibly can.
Well, we did a good job holding it off as long as we did.
Oh,
so.
we did. We were so proud. And all it took was just a few getting out and touching family, touching friends.
Hard.
Made it tough.
All right, any questions about community care? If not, I'll entertain a motion.
Move to approve.
Second.
Commissioner Gammon,
Yes.
Commissioner Gurley,
Yes.
Commissioner Phillips,
Yes.
Commissioner Cook,
yes,
Commissioner Blair,
Yes.
Commissioner Key,
Yes.
Chairman Allen.
Yes, very good, thank you. All right, Ms. Jolly, special projects. This is our report where we track all the construction projects and the spending for the schools. And so she usually updates that for us each month. Is there anything in particular that is any big changes since last month? Okay. Okay. I see the Rocky Fork Elementary is 89% spent, but 100% complete. Seems like that's been lingering for a bit. Do we know?
I did the construction complete based on the like when we pay the contractor every
Right.
time. That's where that comes from.
Okay.
The other's what's still left in the budget to spend.
Okay.
Probably the dates,
Yeah.
the dates and something.
Okay. We'll check with Doug and see what's up with that. All right. You've had this report for a little bit. Are there any questions for Ms. Jolly? It's usually a pretty straightforward report, just paying bills.
Yeah.
Move to approve the report, Madam Chairman.
And we have a second from Commissioner Phillips.
Who was the first?
Oh, Commissioner Blair.
Blair. Okay.
I really don't know. You'd have to ask Doug or them.
Ms.
about
Carroll,
that.
can you use your microphone? Use your microphone. I just want Carol to use your microphone. Thank you.
Looks like the addition is larger than the original school.
Yeah.
It looks like it's ready, almost ready anyway.
Call the roll for us.
Commissioner Gurley,
Yes.
Commissioner Phillips,
Yes.
Commissioner Cook,
Yes,
Commissioner Blair,
Yes.
Commissioner Key,
Yes.
Commissioner Gammon,
Yes.
Chairman Allen.
Yes. Very good. Thank you, Ms. Jolly. All right, school board, they're zooming in. Welcome.
Okay, good afternoon, everyone. We've got two budget amendments. The first one is on 141. This amendment is for additional funding for the comprehensive coordinated early intervention program. This is for disproportionality and discipline issues that were identified the prior year. Funding for this current expenditure are from are 100% from the federal IDEA grant funds that are being transferred from the school federal projects fund. We're currently sitting at an index of 2.3 and we need to get to 1.6. Since last year was a early termination year, it carried over. So we're hoping and we should be off this list come the end of this fiscal year.
Could you explain that index to us, Mr. Spurlock? I'm not sure what that means.
Our index was 2.3 and we need to be at 1.6.
What does that measure, though? I'm not sure what that index measures.
Portion of discipline taken against, white students as opposed to white special ed students as opposed to African-American special ed students.
Gotcha. Thank you.
Motion to approve this budget amendment for this comprehensive coordinated early intervention services. 100% of it coming from the IDEA, approved by the State Department of Education as presented.
Very good. Any questions about the motion? All right, I'll entertain a motion.
I'll move to approve it.
Second.
Good. You call the roll on that one?
Commissioner Phillips,
Yes.
Commissioner Cook,
yes,
Commissioner Blair, Commissioner Key,
Yes.
Commissioner Gammon,
Yes.
Commissioner Gurley,
Yes.
Chairman Allen.
Yes. Very good. Thank you, Mr. Spurlock. We're ready for the second one.
Yeah, the next one is the Fund 177 amendment. We're requesting to move funds between the planned capital projects. You'll find there on your tab. Basically, what we're going to do is we're going to take $430,000 that was allocated to fund a backup server project. In order to renovate it, in order to do this, we're going to renovate some school restrooms located at Smyrna Middle, Oakland High, Riverdale High, and Smyrna High and Laverne High schools. And additionally, we're a request to reallocate $75,000 in funds from the life safety security to rekey the Primus door replacement category and to the life safety security camera program and DVR project category. So basically what we're doing is reallocating the funding to some areas that we've been looking at for a long time. That being our security in terms of our doors and also our DVR and our camera system, along with the biggest project is renovating these restrooms. So motion to approve this amendment between the planned capital projects in the capital project fund to address the presented capital improvement needs.
So what is your plan then for the backup server?
Yeah, that's a good question. What we're going to do is we'll look at that. We know we need it. However, our restrooms have been needing to be renovated for a long time. So we will project that to the next fiscal year and go from there.
Yeah, I have a question along the same lines. At a time when we're having such a large percentage of our students virtual, and I would assume that the servers play a role in that. Or you can inform me that they don't play a role in that. Is it a good time to take money away and not continue with that project?
It is because right now the whole purpose of having the additional backup server was not to increase any kind of capacity. It was in order to, in case there was some kind of catastrophic incident that would occur. We've been looking at these restrooms for a long time, and this is something that the board felt like was worthy of getting taken care of now so that we can address some of the issues where we might have been out of compliance as far as our ADA is concerned, and look at the backup server for the next year.
Is there any of your grant money that's out there that could go towards the technology, could go towards the server? Do we know, Doug?
We have actually gone through all the grant money. Now, if there's some more was to actually reoccur, which I'm not sure that it will, we could use that for that. But we used a lot of our technology money to buy devices and things of that nature.
Because I felt pretty confident if there was future grant money, it was not going to be for restrooms, but you could potentially use it for servers. Yeah. Commissioner Key, you had something?
What would make these restrooms need renovating at the same time? Was it a original flaw or?
Well, they actually are grandfathered in for for ADA compliance, but over the years, the wear and tear on it, the renovation has never taken place. So to bring them back up, even though as far as being an older building, they are grandfathered in. However, as we get more and more students that of special needs, we need to make sure that these are there is enough to service all of our kids.
And the ones you've identified have age on them, obviously.
Absolutely.
Yes.
I think probably the I guess Smyrna and Laverne would actually be the schools that would only be, I guess, what am I looking at, 32 years, or not 32 years, 22 years on them. Am I right? 32 years? That sounds right. Yeah, 32 years. Absolutely, 32 years, and they're the newer ones.
Any more questions for Mr. Spurlock? Any from my commissioners at home? If not, I'll entertain a motion. Ms. Commissioner Blair.
Second.
Thank you. If you'll call the roll.
Commissioner Cook,
Yes.
Commissioner Blair,
Yes.
Commissioner Key,
Yes.
Commissioner Gammon,
Yes.
Commissioner Gurley,
Yes.
Commissioner Phillips,
Yes.
Chairman Allen.
Yes. Mr. Spurlock, while we've got you on the line, is there anything you'd like to share with us regarding your distance learning situation? I know these are challenging times for you all. Is there anything you want to update us on?
Yeah, I think we're improving in that area. We currently have over 21,000 that are doing distance learning. We are looking at our metrics also. We'll be discussing those. We know that the spread rate has gone down, and we know that we are, as far as the positive rate is going down. And we will be providing some metrics that we'll be looking at after the first semester. The biggest thing is we know that, I know it was mentioned on here earlier about the flu season coming up. And it's concerning. It's concerning, but, we really would like to see if we can get some more kids back in the building for several different reasons. Funding is one of those in terms of our cafeteria fund. We want to make that solvent. And we also know that at-risk kids do better when they're in-person learning. So we'll just look and see what the metrics do for us and make some recommendations as we go along.
Any other questions for Mr. Spurlock, your school board?
I have a question.
Yes.
Mr. Spurlock, I heard something on the television earlier tonight. Some of the other counties, when they started this virtual learning, there was a comment made that they couldn't find all the kids. Do you know anything about this?
I'm sorry, I didn't hear that.
On the virtual learning, they haven't really found, they like missing like 2% of the kids in some of the counties.
We've actually, we track ours, obviously, because if they're not, we treat it like truancy. Is that what you're saying? They're not engaging in the virtual learning? Is that what you're saying?
Yes, sir.
Yeah, we've actually stayed on top of that due to the fact that we get funding, and in our learning plan that we submitted to the state requires us to make sure we're doing that. Now, I do know that I think Metro Davidson County had a lot of problems with that. And one of the things with that is they were full virtual and still are right now. And I think that probably created some issues. But with us being a hybrid approach where we got all traditional and our virtual, if you will, gives us an opportunity to make sure that we're engaging and making sure that they're doing what they're supposed to be doing.
Thank you.
All right, any other questions for Mr. Spurlock before we let them go? No. Very good. Thank you, gentlemen. We appreciate you. Appreciate all you're doing.
Appreciate you guys for taking care of us.
Thanks. Very good. Mayor, do you have anything for this group? Anybody else have any business for this committee? Very good. We are adjourned. Thank you all.